Hello, my name's Donna Pywell. I'm Senior Nurse for Patient Experience at Leicester's Hospitals. I'm going to talk to you about our project that's assisted our trust to engage with family members and carers during the height of the COVID-19 pandemic. Leicester's Hospitals was formed in the year 2000 and is based over three main sites: Leicester Royal Infirmary, Leicester General Hospital and Glenfield Hospital. Currently, there are over 16,000 members of staff employed by the Trust with varying skills and expertise. The Trust covers Leicester, Leicestershire and Rutland, which means we serve over 1 million residents. However, with our specialist services, such as our renal service, there are a further 2 to 3 million people who are within our catchment area. The Trust has a strong focus on collecting and responding to feedback from our patients, but also their families and carers, enabling us to drive an ever-improving experience of care. The COVID-19 pandemic has proven to be a challenge. This has been felt at a personal level, but it's had a profound effect on healthcare. There was a need for healthcare organisations to make rapid changes to the way that they work to protect and support patients, visitors and staff. The pandemic also resulted in restrictions to visiting within our hospitals, which has been very difficult for patients and their families, but necessary to protect all and prevent the further spread of the virus. In March 2020, NHS England made the difficult decision to stop the reporting of friends and family tests nationally and advised trusts that this was to help with the increased workload for staff at this difficult time. They also told trusts that they could stop the collection of feedback during this time. In Leicester's Hospitals, we were keen to hear the views and opinions of our patients, but also from their loved ones. Although NHS England continued to hold the suspension of reporting the friends and family test, in Leicester's Hospitals, the collection of feedback in the clinical areas was recommenced in June 2020. This was undertaken after taking advice from our infection prevention team. At the same time, it was also decided that we would look at how we could collect feedback from family, carers and friends. We wanted to understand what the effect the visiting restrictions were having on the family members and carers, if they felt that they were necessary and if they agreed with the restrictions that were in place. As in many cases, family members or carers were not able to come into hospital to visit their loved one due to the restrictions or because of their own personal health problems. Communication with them during their loved one's stay was even more important. We therefore wanted to understand how well the staff were communicating with them and how we could improve this. Patient Experience were able to secure some funding from within the organisation to help with the cost of the project. To highlight the project, it was discussed with staff in the clinical setting and shared at our Patient Involvement and Patient Experience Assurance Committee. This is a meeting which is attended by senior members of staff within the organisation where we focus on patient experience feedback and what we're doing in response to the feedback received. At the beginning of the project, we looked at the questions that we would use, and it was decided that we would use the questions that were asked within the National Inpatient Survey, as they had already been tested with patients for understanding and suitability. But we were keen to keep the questions to a minimum to encourage feedback to be given. The Friends and Family Test question and the opportunity to comment was placed at the beginning of the feedback form. We adopted a variety of methods of collection in different areas to allow easy access. Paper feedback forms were developed and printed. These were attached to a prepaid postage envelope. These were distributed to the inpatient clinical areas. The staff gave them to patients on discharge to take home to their family members or friends to complete. Electronic devices were used in the children's and maternity wards as the collection of feedback method. These had questions for the family members and carers. Both of these areas continued to have one parent or birthing partner present during the patient's stay, so they were able to complete them in the hospital setting. Telephone feedback was a method that was used later into the project. Following a review of visiting restrictions, it was decided that patients who were in hospital for 21 days or more, arrangements could be made for a family member to visit. When the family member visited, the staff would take their details for the test and trace information. Then, with their permission, a member of the patient experience team would contact them a few days later to ask a series of questions about their experience over the telephone. The family care and friends questions were available on the Trust website, and business cards were developed to enable patients to take home. These had a QR scan on them, which would take the family member to the feedback form on the website, which then they could complete in the comfort of their own home. In outpatient areas, we use SMS texting. This continued throughout the pandemic. We added a link at the end of the feedback form in the text that they receive. When family members or carers contact the hospital, the pre-recorded message that they hear details the desire to hear about their experience. At the time of putting in this PENNA application, we'd received 863 pieces of feedback, which until March 2021, when we paused the collection, has increased to 1,223 pieces. Since then, we've recommenced the project in June 2021. The feedback received is themed, shared with the organisation, and the results have directly affected practice. In children's services, one of the themes that emerged was that children were missing their other parent and their siblings. Originally, only one parent could stay with the child during the duration of their stay. The feedback from parents also told us that this was difficult as the parent in hospital was not able to see their other children or get a break, especially if the child was in hospital for a long period of time. Visiting restrictions were adjusted so parents can change over every 48 hours. This made a positive impact, as very quickly the number of family members who, when they were asked if the visiting restrictions were the right thing to do, those who said yes increased from 74% to 91%. To aid communication with the children's siblings and to entertain the children, a drawing competition was launched. The children were asked to design a postcard, which, when the winner or runner-up was decided, was put onto the Trust website so that the children's brothers and sisters can send an e-card to them during their stay in hospital. For the children who were patients, postcards with templates on them to colour were produced and printed. When completed, they can send them home to their siblings or family members. This has proved to be very popular. One of the themes from the maternity services feedback was that partners were not able to support the women as much as they would like. The restrictions were reviewed and changed, taking into consideration infection prevention advice to allow birthing partners to attend appointments for scans and during the maternity experience to support the ladies after they've given birth. The result of this was positive, and there's also an increase in the number of family members who supported the visiting restrictions from 63% to 70%. It was evident from the feedback received that the restrictions were having an impact on patients and their families, that they needed to see their loved one to reassure the person in hospital, but also for their own reassurance. After reviewing the feedback while still maintaining safety, it was decided that patients who had been in hospital for 21 days or more, arrangements could be made for the family member to visit them. This has since been reviewed again, and now for adult patients who have been in hospital for 14 days, they can have a single adult visitor. There are other exceptions for those who are vulnerable and requiring assistance, or for those at the end of life. For patients and carers, the restrictions have made obtaining information about their loved one's condition or treatment more of a challenge. It was evident very early on in the project, from the feedback received, that improvement was needed in how much information family members or carers received about their loved one's condition or treatment. This feedback was shared with the organisation, who undertook some focus work, and this SPC analysis shows the results at trust level. As you can see, there's a significant improvement in the response to this question. The first period of collection of feedback from family carers and friends was halted at the end of March to allow us to look again at the feedback received and review the questions we asked. It was decided that we needed to continue collecting feedback in the inpatient areas, as this feedback is invaluable to the Trust, and although there were some changes to the restrictions, they are still continuing. Further funding was acquired and new revamped forms were printed. The project was recommenced in June 2021 during Carers Week. As the restrictions have eased slightly, it was decided that the family carers and friends feedback forms in the clinical areas would also be updated to reflect the feedback forms that were being sent out to the family carers in the community. These forms are available for any visiting family members or carers in the clinical areas, including children's and maternity areas. The friends and family test scores and comments received are shared with the clinical teams, allowing them to take the appropriate actions to improve the experience of patients and their families. Thank you for giving me the opportunity to share our project with you. Please let me know if you have any questions.